Alright, good morning. Today we will be explaining why switching to a single-payer healthcare system in the United States will be beneficial for all citizens. Right now, the current healthcare system is broken and it needs to be fixed. A single-payer healthcare system is explained as such. Single-payer healthcare is a healthcare system financed by taxes that cover the cost of essential healthcare for all residents, with costs being covered by a single public system, hence single-payer. Over the course of this debate, we'll explain why the current system is not working and how we're going to fix it. Then next we'll be going over how the new system is going to make everything cleaner and better for all citizens in this great country to get the healthcare that they deserve. Right now with the current system, there are far too many taxpayers in this country that don't have any healthcare. By switching to a single healthcare system, we'll be able to get them what they need. And all those reasons for not having healthcare are from different reasons. And they can come from such reasons such as financial hardship. Others come from not having the resources to get covered. Also, some of the current coverages that some private companies are giving are insufficient enough for the treatment that some of their customers need. So right there, that's a really big problem. Some people are already paying for healthcare and they still can't get the coverages that they need. A study in 2009 by the Harvard Medical Research found that there are 45,000 annual deaths in America due to no health care or lack of proper benefits due to their health care being insufficient. Also, by going to a single-payer healthcare system, it will help curb poverty in the United States. Even though insurance agencies that give health care are about providing care for their customers, at the end of the day, just like every business, they're there to make a profit. Year after year, medical costs have gone up and up. At what point does the country think, why does it keep going up and up, and when are we going to stop and curb this trend so that everyone is able to have affordable health care? Some say there's not enough money to start a nationwide healthcare system, but that just isn't true. There have been studies to show that the U.S. spends twice as much as other countries just to have a system that restricts healthcare, not expand it. Also, by going to a single healthcare system and making it right to healthcare, those who die simply from not having healthcare will be able to get the treatment they need. Some may say, have an argument say, well, if someone's terminally ill, what's a single-payer healthcare system going to do to save their life? I would probably bet somewhere along the line of that disease they weren't able to get the coverage that they needed due to their healthcare, and over time, the condition got worse instead of having a single-payer where right away, if they had a problem, they could go see the doctor and get that taken care of. Once we get the single-payer system running, it'll be super easy to go to see a doctor for your needs or whatever you're feeling, no matter how minor it is. I think we've all heard a story of someone who doesn't have health insurance had an accident where they might have broken their leg and they didn't want to call the ambulance because of all the prices and that you get by using an ambulance. I forget what the number is, but an ambulance ride isn't very cheap. Under the single-payer healthcare system, no one will be scared to use all the resources because it's already taken care of by the single-payer system. Also, by going to single-payer health system, it will help economic growth. Studies have shown that healthcare is better for workplace productivity compared to an employee who doesn't have healthcare. Some may say, yes, jobs do offer healthcare to some employees, but not all of them do. Also, healthcare, a single-payer health system will save lives as well as money. We will become a healthier nation because of it. In the year 2018, it's time for America to put their citizens and health first and stop with all excuses why we can't set up a single-payer healthcare system. Let's not forget also, there isn't a big problem with prescription drugs in this country where doctors and big pharma are just trying to make a profit instead of helping people, where doctors are filling prescriptions like crazy and they actually all make money off of filling these prescriptions. So, it's no different from going to Sprouts or Ralph's. They just want to sell you the best product so they can make the most money. By going to a single-payer healthcare system, we'll be able to regulate all that stuff, and doctors who abuse their power will be able to be found faster and will be able to regulate it better. And it's time for the government to step up and give a healthcare system to citizens like other distinguished countries have in this year.